to Silicon Valley Nonprofits, a service of KMVT Community Media. I'm Bev Lenahan, your host. Today our guests are J.P. Sahi, CEO of RotaCare, and Dr. Gregory Thompson, Medical Director of RotaCare of Monterey. Thank you both for coming in to see us today.
Thank you for having us.
We want to make sure we get the word out about RotaCare. So JP, I'll turn to you first. Tell our viewers what RotaCare services are and why they're so important today.
Sure. RotaCare is a volunteer-driven organization that provides free medical services to the uninsured. Our mission is to provide services to those with the greatest need and the least access.
Access, that's a challenge today, particularly with transportation being what it is. Yes, and Dr. Thompson, with the high unemployment rate today, you would think that this wouldn't be such an issue, but it still is, even in the Greater Bay Area. Why is that?
Well, the fact is that, and I believe the estimate that came from the Labor Center at UC Berkeley was that there are still 1.8 undocumented residents in California that are uninsured. These are working families, but they can't afford to pay for insurance premiums, and they don't qualify for state-sponsored insurance. Many times they can't afford the sliding scales that some county programs offer. And so, you know, RotaCare is an important program to fill that gap and provide care to these workers that are, in many cases, long-standing, productive members of the community that are there are gardeners and housekeepers and kitchen workers and skilled laborers, and they have families to feed and they have children in schools. So if we can keep them working and address their illness before it becomes an emergency, then that's very gratifying to us.
For everybody. They really form the infrastructure of our economy, and I think
they're the underpinning of our working class.
We're seeing that more and more as people are having a difficult time staying in the area. At least we want to keep them healthy, right? So it's all volunteer. What kinds of services do they get when they come, JP?
So I'll tell you a little bit about it, and then Dr. Thompson can give you more detail.
That would be good.
So basic urgent care services. Some of our clinics also have more expanded services to cover some chronic care diseases. So anyone who walks into the clinic, you know, with a cold, a cough, a sprain, will get seen in the clinic, and then we do have repeat patients who come in for some of their chronic diseases.
And what would those be?
Well, sometimes they'll come in for what they think is just, you know, fatigue or something, and we'll run some lab work on them and find they have diabetes that they were not aware. But we can educate them on diabetes, get them on medication, get their blood sugars controlled, and provide ongoing care for their diabetes. We can, in Monterey, we can send them to an optometrist so they can have their annual eye examinations. We do their annual foot examinations so to make sure that the diabetes doesn't get out of control and cause any complications.
It'd be really dangerous. Well, how can people support you? We know you need volunteer professionals, volunteers to help with other things, and certainly donations to help carry on this program.
So we are volunteer driven. Any type of volunteer, from registration, front desk, interpreters, to licensed professionals, including nurses, physicians, and we don't get any government support. So RotaCare is purely donation driven, so we're always looking for donors.
So give us your website quickly and your phone number.
It's www.rotacarebayarea.org. Our phone number is 408-379-8000.
Wonderful. Well, we hope you'll get a lot of support. Thank you both for being here.
Thank you very much.
Thank you for having us.